You said that other countries are doing research for maybe a vaccine for this thing. But how about Nigeria? Do we have the capacity to engage in research for a vaccine for Ebola virus disease? I mean, after all, there is something that we can use to treat Lassa fever now, even though perhaps it was not formulated in this country. But this is a problem of Africa. Do we have the capacity to do research?
Of course, yes. We have trained consultant, and in fact, the president has formed a group, a research group on discovering vaccine. But as you know, this problem is a threat to the international community, and we cannot do it alone. And that is why Nigeria has been working with the World Health Organization. Nigeria has been working with the CDC, with Bill and Bill Gates Foundation. So this combination and collaboration, we eventually get there. It might take some short time.
You've mentioned that we do have experts, but I was reading, somewhere that the labs used for the research for things as dangerous as Ebola virus disease are different from regular labs. They talk about biosafety level 4 labs. Do we have the equipment? Now that we've certified, we have the manpower, but how about the infrastructure? Is this something we should be looking into? Do we need to build?
We have serious problems with our health infrastructure in Nigeria, which I believe if we don't do something about quickly, we might have a problem in the future. We have seen how Nigerians move to other countries, Dubai and European countries and India to go for treatment. That is a sign that we have infrastructural problem. We need to improve our infrastructure. If we want to have a good result, there is a need for the government, not only the government, private sectors, to invest in health infrastructure so that at the end of the day, the MDG's goals will be achieved.
Okay, private sectors as well.
The private sector should be active in this. I believe the private sector should be socially responsible. They make their money within this community, and they need to bring back and put back to the community. And we should enforce them to do this. They all know that they need to bring back to the community, and they should take advantage of this. At the end of the day, it will be a win-win situation for everybody, every stakeholder. Although it's a long-term investment, but it worth it. Every life saved worth it.
Ebola has been known in the past to kill about 90% of its victims. But we have had a very, very good result here in Nigeria with so many people coming out alive after having Ebola. If you were asked, what was the difference? What made the difference this time? Why did so many people come out alive? What would you say that is, or what would you say those things are?
We have to first of all commend the federal government of Nigeria for the rapid response to this issue. The Lagos state government also, thank God, they were also active and also very proactive in this. This is one of the reasons why we're able to contain the spread. Speed is very important in terms of controlling Ebola spread, because you need to trace and track the people that has a contact with the victim. And with all these moves and all these actions taken by the federal government and the state government and all the state governments in Nigeria, because all the states have set up committees, and that is why we have been able to solve this problem.
We've had reports that the numbers are rising. What would you say by way of advice to them?
By way of advice is, first of all, to reach out to international communities. It has been proved that they haven't got the resources that we have in Nigeria in terms of personnel and financial resources that we got in Nigeria. They should reach out to the international community, both in Africa and in all the continents. And thank God President Obama has come up with a robust package to support these countries. And we believe that with time, we'll be able to reduce the numbers.
So are you saying that that's all they can do? Can't they do anything on their own that would help them come out of this?
The spread of Ebola is always through contact with the victim and not following the rules laid down by the health institution on how to prevent Ebola. You know, once they have contact, they should first quickly report themselves, and there should be separation, and also whereby they will be able to quarantine them, and from there treatment starts. We know that the incubation period is between 2 to 21 days, and within this period they should be able to come up quickly, and that can also come up quickly with sensitization and awareness.
Yes, I was going to go there. Yeah. Do you think that part of their problem is that they don't actually understand this disease?
Part of the problem is culture. Africa culture is diverse and sometimes could be complex. Belief. And this is one of the reasons where people were able to contact this disease. Our culture in terms of taking care of our sick, lack of infrastructure, people take care of the sick at home, and our culture in taking care of our death, the rituals and the rites they perform on the death before being buried, these are factors, and these are avenues that this could be spread quickly. And that is one of the things where communication and awareness creation is very important.
Okay, you say that it's inevitable that there will be breakouts of diseases from time to time. But other people are of the opinion that we can have some strategies, public health strategies, that will ensure that we don't have this kind of thing again.
We can prevent breakout if we follow the guidelines as being produced by the Ministry of Health, by the CDC, in terms of having less contact with the victim, coming out quickly to report ourselves, following the quarantine processes, and also living a hygienic lifestyle, attitude and behavior changes, washing your hand with soap and water at the appropriate time. If we follow all these simple guidelines, lifestyle, we can prevent the spread. Before we found the vaccine, after finding the vaccine and discovering the vaccine, then treatment will start, and then eradication of Ebola will take place finally.
Do you think Nigeria has the manpower, the strength and the infrastructure to reach out to our neighboring African countries who are still suffering from Ebola? Are we able?
We are able, and we have the manpower. But the question also is, do we have the political will to do that? Because we have challenges too within our system. Our population is huge, over 140 million people, and we need to take care of this population first of all. We have security issues, we have economic issues, and we have political situations that we need to sort out within ourselves. These are the things that might affect our political will to assist our neighboring countries. But also, we claim to be the giant of Africa, and it is our responsibility to reach out to our African brothers in terms of engaging and supporting them in the time of their needs.